Yes, hello, good evening. How are you day? How are you? Welcome again. Today now the 28th of May 2023 and the time now 8 p.m. Welcome to Ask the Doctors. This program now every Sunday by 8 p.m. West African time with a day here and we dey talk about health. So today now question and answer session. So we go take your questions. If you get questions for us, we go take your questions, send your question here. But I want to talk something. We dey stream live on Facebook and we dey live on YouTube. Also, get one post where I make talk say somebody create another Facebook account, and the account no be my own. So I beg, make we dey careful. Also, again, we know they share number online. We know they do private chats because of all these people where they try impersonate us. So no vex. But here, if you get any questions, we go do our best to take your questions. Now, people they here. Good evening. How are you? Where you they watch me from? Good evening, everybody. I'm so enjoying you. Balogun, guy, how far? Who be this? Joy Obaze. I see you. Faith, how you there? Grace, Grace Emmanuel, how are you? Okay, if you have any question for me, um, if you have any questions for me, please drop your questions in the comment section. Yeah, yeah. Let's go. Share the live. Tell me, I'm watching from where? I'm watching from Lagos. What is the cause of miscarriage at 6 months? What's your name? Floxy Bazwaye. Good evening, Grace. I see you. Okay, you're fine. Now, this is how it is. There are many things that can make a woman lose a pregnancy at 6 months. It could be from the woman herself, it might be from a problem with the placenta. Do you understand? Or it might even be known. Yes, Dr. Israel is in the house. So, if you just come, Dr. Israel Alpha,
Adele, good evening.
yeah, evening. It's been a while. You look stressed. What's in the happen?
Nothing much. I just, I just get small issue with my gen. So
Okay, good. Now, welcome, Dr. Israel. So we get Dr. Israel in the house, my co-host. We have a question here. We will do our best to answer as many questions we come here. But no forget, help us share the live. Dr. Israel, there's a question here. Matt, give them to you. So, what's the cause of several miscarriage at 6 months? Your mic is muted. Okay, go ahead.
yeah, I'm with you. What's the cause of several miscarriage at 6 months? Uh, okay, that can be due to so many things. I think Dr. Fred has we have a video on miscarriage, and this
Yes,
person will
yes.
benefit very much when he go and watch that video. So having miscarried at 6 months, you need to one of the things I would want to say, you need to check your Rexox factor. If you are Rexox negative, and you need to know if you are already be exposed. That can be one of the reasons that can cause that. Another thing is you know, drugs you take can also cause that. Also, depends on the kind of miscarriage you're having. You want to see if your uterus is even strong enough to hold pregnancy. So if your uterus is not strong enough to hold pregnancy, you can be having that kind of miscarriage. And you just be noticing that it's not always that 6 months. It can just be within 5 months. It could be 6 months. If I may use weeks, we may be saying 16 weeks, 18 weeks, just like that. I notice that that's when you are losing
Yes.
the pregnancy and it goes up, up and up. So you need to check how strong the uterus is. If the uterus is not strong enough, not very strong, it may be causing
Whoa.
that. Um,
Dr. Israel, your network is breaking. So let me add to what Dr. Israel has said. There's a video on my page, on Facebook, on YouTube, on miscarriage. So Floxy Bazwaye, go to that video. It's about 30 minutes, 1 hour. Everything you want to know about miscarriage is there. Number two, if you have been having several miscarriages, the best person for you to see is a gynecologist. So I will encourage you to watch the video. The videos with a gynecologist and experts, and then please see your doctor. I'm enjoying your lecture. Thank you. Dr. Israel, are you back? You're okay.
Can
Dr.
you hear
Israel, can you
me?
hear me? Yes, I can hear you. Your network was breaking up.
Okay. Don't know
Okay,
why.
let's
I
take
can
this
hear
one
you
very
clearly.
fast. It says, is it good for a man to be having sex always?
Okay. For a man having sex always, it's not like it is bad, because also it will help to reduce the risk of prostate cancer. However, I don't know your always. I don't know what you mean by always, if it's every day. But I can vividly tell you that not everybody that can have sex every day. If you not tire, your guy go tire. So it is just like that. So it is not actually bad for a man to be having sex always. It's not really bad. At least, as I earlier said, it can actually protect man from having prostate cancer. It's also a means of reducing stress. And sex is also a means of reducing stress. So it's not really bad. But you should also know that too
Oh,
much of everything, too much of everything, as we always say, is bad. So that's why I say I really don't know when you're always what it means. But I know it cannot be every day.
okay. Thank you, Dr. Israel. Now, let's say this before we continue. Please, for those who might be wanting to ask us for medication, in case this is your first time here, maybe not your first time you they come. Why you they speak English? Why you go back to pidgin, Dr. Israel? In case not your first time, it is. I beg, no vex. We know they prescribe medicine here. We know they make diagnosis here. The only thing we they do here now to educate you and to advise you, so that in case you ask us any medicine and we not give them to you, you know what they angry. Apologies. We get guiding principles. Furthermore, we go beg you, help us share the life. Okay, we have a question here. Please, can someone ovulate without seeing her period? Okay, let me say something quickly before I allow Dr. Israel say something too. So I had a patient some years ago. This patient did not see period, but he born about 7 children. He's late now. She's late. Now this was the only patient I have seen. And the reason I'm saying this first, there are some very funny thing that can happen in your body that might shock you, that you might never have heard before, you might never have seen in medicine, though it doesn't follow the normal pattern. Doesn't. However, if you know you have not been ovulating or you are not seeing your period and you are scared, the final advice would be for you to see a doctor. Do you get? But there are some abnormal things that can happen that goes out of the normal we see in our society. So a woman will not see period. She might ovulate. But most times, a woman who does not see period, we call it anovulatory cycle. They what we call anovulatory. That a woman might even see period, might have a normal cycle, yet she will not ovulate. So it's both ways. Dr. Israel, over to you. Oh, what happened to his network? Dr. Israel, your network. I don't know what happened. Okay. Let's go to the next one. What could cause constant headache and body pains? What could cause? Dr. Israel, are you back? Hello.
Hello, Dr. Fred.
Yes, you're back.
Sorry. I actually pressed one wrong button like that. Okay. For
Yeah,
that
respond
question,
quickly. Yeah, respond
for
quickly.
that question, if that woman don't first born, if that woman don't first born, eh, it is possible. Why I talk so is because ovulation come before menses. Now ovulation that they first see before menses they come. So most women when you don't first born, because their menses not a quick return, some of them before the menses return, they don't, as I earlier talking now, ovulation they first come, they don't knack, they don't get belle again. So because ovulation don't take place, they don't get belle again. So they not go actually see their menses again. So some women are like that. As I earlier said, my first word now be say those women, if they don't first born, women when don't first born. As Dr. Fred talk, there are some people when their body not they follow the normal way when other people body they follow. For all those kind of persons, something like that will happen. But we get some people when we say as they just born, those people they quick get their period back. But before the period come, they need to ovulate. So sometimes during that period, as they just ovulate, they knack, they go just get belle. So period not go come. I don't see person wey give birth to 4 children like that. E not see period within that space of giving birth to the 4 children. This is not be say anything they happen to am. We first they see in menses, so but after he first pikin, before the second pikin, before menses return, you don't get belle again. Before menses return, you don't get belle again. And so you born all your children. So it's possible. Yeah.
Let's share quickly to the next one. What could cause constant headache and body pain?
Constant headache and body pain. The kind of work when you do go fit give you constant headache and body pain. And in fact, let us say stress. Stress now be one main cause of constant headache and body pain. Then malaria fit still give you same symptoms of body pain, but most of the time na joint pain that one go really cause body pain also, then headache. Now it can also depend on the kind of headache. But the first thing when you go they look at now stress and the kind of work when you they do, now go really tear. Now go really tear the kind of stress when you expose yourself to, and when go fit give you that body pain and headache. So when you continue to get body pain and headache, you need to see your doctor. That na first thing. Also, I would say advice make you try rest. Make you try rest from any severe work when you they do during that period.
And other things they too wey fit cause constant headache. At the very extreme, some people fit get even problem inside their brain. Something go dey fit dey grow, space occupying lesion fit dey cause them constant headache. But because you talk about headache and body pain, wetin Dr. Israel tell you, I go advise you make you try to do am. Okay, doctor, please. I was where the other day and they said my sugar is low, but after then I checked the sugar, it's normal. So please, I want to know why my sugar went down before. Dr. Israel, I want to respond to this.
Okay, and why your sugar first low? I may not be able to tell you say now this one be the reason. Sometimes maybe you not eat food. Now most of the time, most people will not eat food. Their sugar they low. Also, if you overstress yourself, your body will use up almost all the sugar within your body. Then it will give you low sugar like that as well. And another thing is that as we talk, we never know where you go when they tell you say your sugar low. If it just be say it's normal, now they just tell you say it's low. Because when you go recheck, you say it can't be normal. And I don't think after that time, I go advise maybe you go recheck again. If it still remain normal, I beg, I'm not sure say you get any problem. Just eat your normal food and like yourself the way you are.
And if I go add something, I don't know who you see, because if you see doctor and he tell you say you get low sugar, you go and find out whether you get other symptoms to know what they do you. And if you check again, your sugar dey normal, and you dey fine now. You dey fine. Somebody ask us a question. Say, please, what can cause over headache like it has last like a year, and now when it's cold, it will look like cold is entering my head and pains on my stomach. So if I understand you, you talk say you dey get headache and the headache don't reach like 1 year. Is that what you are asking us? Your headache don't reach for 1 year, and when the weather they cold, it dey affect you for your head, and you dey get pain for your stomach. Headache for 1 year, my guy. Waiting they happen. What have you done? What have you done? Headache for 1 year. I believe that this one don't pass ordinary. This one don't pass normal. You don't pass. Be careful. Everybody with they listen, nobody go they sit down, they say I don't get headache. So what you don't do, you don't go hospital, you don't see your doctor, what medication did your doctor give to you, and also whether you go chemist or pharmacy. So let us know, because they okay for somebody to get headache for 1 year. They abnormal, totally abnormal. Something else they where they cause the headache. Dr. Israel, you want to add anything quickly?
And as you don't talk, something they when they cause the headache, I advise them you go hospital, go see your doctor. It is very important. If you be say the thing they grow small, or maybe now something burst, yes, something burst for your brain now, you never know. And when you're the leak small, maybe the artery or the vein cut or break. When you just the leak small, they cause you those things. You never can tell. So it go good make you go hospital, make them see you properly. Then we will know what next. That 1 year too long.
Doctor, please, can a pregnant woman that is less than a month deworm? May I allow Dr. Israel respond? Because I know why they ask me, because I make video on deworm. Are we? Let me they ask me. Okay, Dr. Israel. Hello. Waiting they happen to your network. Dr. Israel, your network don't scatter. Okay. So, madam, I no go advise you to go deworm. You get any problem, why you won't go deworm? Leave yourself alone. Live your life, carry your belly. When it's time, I don't know how many weeks you did now, less than a month. You don't even go hospital, let them know say you did pregnant. Sure you get, because the moment a woman get belly, when she knows that she's pregnant, we go tell her make she go hospital. But our people go tell you say make you wait for 3 months, which is very, very wrong. Nobody talks say woman will get belly, make she wait for 3 months. So if you know say you never go hospital, speak with your doctor. The best thing to do now not to go there. But me no go tell you say make you go deworm now. Rather, see your doctor. When they check you and they feel say there's a need for you to deworm, they will let you know. Dr. Israel, your network. Somebody's asking us a question. Grace says, please, can first release of a man make baby? First release. What do you mean by the word first release? First release. What do you mean by first release? I need to get it well. What do you mean by first release? How many release a man they release? Which one be the first release, please? I don't understand by first release. Is it I see when a man meet a woman, anything come out from the man body. If sperm dey inside.
You dey hear me?
Okay, you don't come back. I dey hear you now. Welcome.
Okay.
Okay. Somebody they ask us question. Say, please, can first release of a man make baby?
I don't know what to be first release, but if na sperm, as he enter, if he make baby, whether na first, whether na last, anyone can make a baby. If only one thing, if the woman they are fertile period, then baby is most likely. If the woman they are fertile period, one. Also, if the sperm is viable, two. And so whether na first o.
Oh my God, Dr. Israel, your network was acting up. Okay, so Dr. Israel don't give you the answer. Waiting they always cause dizziness. I make video on this one now. There's a video about dizziness. It did my page. It's a video, Miracle. There's a video on dizziness. The video they everywhere. They Facebook. They my private group too. My private group. I dropped the video there. There are many things that can cause dizziness. If you no sleep well, you dey severely stressed, you get low sugar, if you get dizzy, you get problems with your heart, you get problem with blood, you have a low blood, low PCV, your red blood cell count they low. If you dey dizzy, do you understand? So, or you dey hungry, if you feel dizzy, so many things there if you make somebody feel dizzy, or you get issue even for the head, issues with the head. This is why we dey always tell you say if you get any problem, you need to see your doctor because we get many medical conditions wey fit give you this kind of complaint. And as you dey follow your doctor talk, we can't know say no be this one, no be this one, no be this one. So when you dey feel dizzy every time, you get many things where they cause them. Even person wey vomit, eye fit turn you. Do you understand? If you feel dizzy, person wey get problem with the ear, and vertigo, eye fit still dey turn am. So there are a whole lot of stuff if you make somebody feel dizzy. Dr. Israel, we have a question here. What could cause back heels pain? Share the live, share the live, share. Dr. Israel, you dey hear me? Oh yeah, make una share now. Keep sharing, keep sharing. We cannot hear you. We cannot hear you, Dr. Israel. You have to go out and come back again. Your network don't cease. We need to hear you. Back heel pain. Back heel pain. I know feet tall and waiting they cause some really. Maybe now job, maybe you stand too much, you stress your leg. If you feel pain for the back of your heel. Dr. Israel, if you dey hear me, exit and come back. Your network the hook. Maybe you dey stress your leg, you can't job where you do, you stretch too much, rest your leg if you feel pain. Can one take anti-malaria without being down with malaria? The answer is yes and no. Yes, for certain group of people. You get certain people where they give anti-malaria to prevent them from getting malaria. Certain group of people. And then if you know they're among those group of people, there's no point giving you anti-malaria. Number one are pregnant women. When woman get belly, they give her medicine to prevent her from getting malaria. So that one day. And then some people too will get sickle cell. And they give them sometimes anti-malaria to prevent them from getting malaria, and some other people. So if you know they for that group of people we need anti-malaria to prevent them from getting malaria, there's no point. Somebody go talk say I never treat malaria for 6 months, I won't go take malaria medicine. No, you don't need it. Now only when we know say malaria dey your body, then we will tell you say confirmed with test, go take your medicine. Dr. Ezra, you won't add anything again to this one?
You're not supposed to take anti-malaria when you not get malaria. As Dr. Fred talk, except you did that group of persons. And one of the group of people are pregnant women. The another people are sickle cell people. Those are two set of persons when we quick give anti-malaria. And another set do, but I just want to mention only those two because in 9 they come on most of the time.
Okay.
But if you not get malaria, you don't need them.
If you just they come or you just they follow this page, welcome. There's one thing we know they do for here. We know they give medicine. The highest medicine we have to tell you now vitamin C. Go and drink your vitamin C. Or paracetamol, because sometimes you don't even need a doctor because if you buy them over the counter, vitamin C. But if you get medical problem and you they find medicine for here, I beg go. We know be that type where they prescribe medicine for people on social media. Is that okay? So in case you ask us questions for medicine, we go ignore your questions. We will go to the next one, so that we don't get time to waste because so many questions they hear. Let's see. I woke up with a slight fever, weakness, and dizziness, but it disappeared in the afternoon. Me no can understand what in cause am. Dr. Israel.
And you need to still watch your body. I'm not sure say anything serious they happen. And just watch your body. Maybe not the weather and I just affect you at that point. However, watch your body in the next, maybe try the day, the next day, and see if anything go, if you go feel anything again. Then if you feel anything, I think you could go hospital so that they can run 1 or 2 tests for you and tell you the medication when you go feel bad. But as it is now, I don't think you should worry. I'm not sure say make you worry yourself. Yes, if you go get a lot of fruits and vegetable, maybe they eat, so that your immune system go increase.
Yeah. Okay, this question, sick comment here. It says, why am I always wet whenever I'm chatting with ladies on Facebook or thinking about my wife? Dr. Israel, please help us answer this.
I would say to some extent, for some persons, not normal. And when you are on, depend on what you they chat with them, and depend on what your feelings being towards them. Most of the time, now your feelings towards them, and they cause whatever you they get. If you they always get one kind sexual feelings towards them, you always have that. Or if it's a lady that your emotions, you have one kind emotions towards, you will always have that. Apart from that, you will also notice not be everybody they do like that for you. Forget say you say whenever you are chatting with ladies or on Facebook or thinking about your wife, you will still know say not be every ladies now they happen to you like that. So now mostly those ladies when Dr. Fred.
You're back.
Okay. Yeah, now mostly those ladies when be say you get some kind of feelings for, or you don't really get something with. Now you feel they get those kind of things with. So I don't think and you don't need to worry yourself about it. It's just for you to condition your mind. For all those other ladies where you don't want, just condition your mind and focus everything on your wife. If not only your wife, no problem. You feel they think and they get anything where you want get. Not bad.
Okay, thank you. They know they share the session. No, people know they share this live session. Why? Why are you guys not sharing now? Okay, let's go to the next one quickly. Those on Facebook, are they come? I see a comment from Facebook, from YouTube. Sorry. Okay, there's a question here. It says, "Doctor, please, what is the cause of painful menstruation?" Oh yeah, share, Dr. Israel.
Okay, when we say painful menstruation, it depends. For some persons are normal. Those people where basically that before the menses starts and they go get pain. For them and for some of them are normal. Maybe for the first day also they see they get pain. For some of them are normal. However, if you can't be say you they get pain all through the menses from the beginning to the end, the pain is serious. Na there wahala dey dey. Na there wahala dey dey. Things like endometriosis fit cause am, things like infection fit cause am, things and so many other things. I just make I mention those two. Even fibroid fit even still cause am. So when you don't notice those things, I think you need to run, go see doctor, gynecologist to be precise, doctor wey dey specialize in women. You need to go see them. Make dem for follow you up and really find out which of them they make you get this kind of serious pain during menstruation. As I earlier said, for some people, now normal if it just be the before the menses and just for the first day. Because sometimes when they get that pain, once you don't reach the first day, after that first day, the pain go just well off.
Okay. This question now from YouTube. Those were there on YouTube. Oh yeah, I'm making a send una questions. All the people on YouTube quickly. Good evening. I beg, I want to ask. Person staying hungry for hours or not eating days, can it cause ulcer? I'm Mechi Sunday. I think you'll be new follower. So there's a video on my page on ulcer. There's a video on my page. For that video, we talk about what they cause ulcer. We talk about what be the symptom. We talk about what be the diagnosis, because people go just wake up, tell you, say, I get ulcer. Number one, if you know it, it go aggravate your ulcer. Not eating go fit give you gastritis. No be say it go cause you ulcer. Gastritis na inflammation of your gastric mucosa. Not eating, hunger fit give you gastritis. Or if you get ulcer, if you worsen your ulcer. But other things dey where they cause ulcer. And because of time, we could not repeat ourselves. I don't know if my doctor here go on add anything, but there's a video on YouTube about ulcer and on Facebook. Go and watch it, and I promise you, you'll be glad you did. Dr. Israel, you want to add anything quickly?
No, you don't talk and finish.
Okay. Doctor, can high blood sugar cause infection? Dr. Israel, want to respond to this?
Okay, high blood sugar not go cause infection. The only thing is that high blood sugar feel worsen wound infection. It feel worsen infection, but it not go cause infection.
Yeah. If I add, meaning say if you get infection, high blood sugar go make it hard for the thing to heal. But because you get high blood sugar, no mean say you will get infection. But high blood sugar, if you carry your immune system go down, high blood sugar confirm, if you we call diabetes. If you make your immune system go down, when your immune system go down, anything will enter your body, if you can enter, can cause you infection. Do you understand? So may we get them clear for you. Meaning, blessing will confuse you. We have a comment here. Doc, something is always vibrating with heartbeat sound on my left ear. I went to see ENT doctor. He checked and gave me some medications. After finishing the medication, I still feel the same thing. What can I do? Okay, Israel, you want to respond?
With heartbeat sound on my left ear, and I went to see an ENT doctor. He checked and gave me some medication. After finishing the medication, I still feel the same thing. What can I do? Go and visit the ENT again. Let her know, say you see they feel that same thing. When he give you the medication, the first question I will ask, was there any improvement? That's the first thing. Was there any improvement? Did they try to look into your ear to see if there's anything inside the ear, or if there's eardrum problem? So those are like the few questions I will ask. However, you need to go and see the ENT doctor again.
Okay. Doctor, despite I did not see my period this month, I walk along with the ovulation kits. And on the 17th day of my supposed period, on the 17th day of your cycle, not period, on the 17th day of your cycle, it shows more obvious than the rest. So does that mean I ovulated? I'm trying to frame your question well. You know, see your period, this month. You use ovulation kit, the track. On the 17th day of your cycle, not your period. You know, if you get period for 17th day, you can't see with your ovulation kit, say it show, let's say it show you 2 line abi or sign say you don't ovulate. Okay, does that mean you ovulated? Yes, if it means say you ovulate. No be say woman must they see period every month. Some women their period now once in 2 months. Women we get 35 days cycle. So our question to you now say, what will be the length of your menstrual cycle? You even know I'm at all. You understand? Because every woman believes it, and this month I must see period. What if your cycle enter 32, 33? You go change now, go to the other one. Even if you don't see period this month, it doesn't mean you have a problem. So Israel, you want to add anything quickly?
Okay. This they follow
Dr. Israel, your network don't break up again. You don't break up again. You don't break up again. Let me see. How far? Can you hear me? Oh yeah, talk to me.
Yes, I can hear you.
Oh yeah,
can
go
you
ahead.
Hear me?
Go ahead.
Okay.
Yes, I can
For that
hear
lady,
you.
I will not want to say maybe na ovulation in C. Reason because that kit when you they follow, what is the date you use as your menses, as your supposed menses, when you can't know your 17th day? So it's not realistic to me. To me, it's not really realistic. You cannot be assuming in your body system. There's no room for assumption. There's no too many room for us. If you not see your menses, you not see your menses. If you see your menses, you see your menses. The only time you can say, I not see my menses, there must be a reason why you not see your menses. So as Dr. Fresh say, either you get long cycle, we go know say that every 2 months you dey see your menses. But if you know say you dey see your menses every month, you not can see your menses, then be say you don't miss your menses. It means say you go check whether you don't get belle or not. If you check say not be belle, you will need to go find out why. Whether you do family planning, we go confuse us say maybe not the family planning I make you not see your menses. So you not need to say you assume 17. I don't know how you take get that 17th day when you never see menses. It is go like that. So I beg, as I earlier said, you go need to just go see doctor, tell am say you not see your menses. And I bet you, if you be woman wey dey look for pikin, congratulations, you don't get belle. Most likely.
Okay, we get question here. Doctor, what is the cause of something moving in the body? Oh.
Dr. Fred, answer now.
Okay, may I respond? So what is the cause of something moving in the body? So this complaint, we dey hear am well. Now, most times, if na elderly person talk this thing, it dey carry our mind go somewhere. If na young person talk this thing, they carry our mind go another place. That's number one. Number two, we dey call am most times psychosomatic disorder, especially when no known cause dey. Maybe you dey go through one kind of challenge. Some people they feel am for their body, say, bless, some kind of things they work out for my body. You understand? Or maybe you even get a type of nutritional deficiency. You feel get them. So waiting be your own, between they cause your own problem, and we know if we tell you. But waiting feel cause them life issues. Even people will get mental health challenges, we get this kind of problem. People where they severely stressed, when they sleep, sometimes if you can't get this kind of issues, people will get some kind of nutritional problem, if you get them. So if this thing they really disturb you like this, again, like we go talk, you're going to need to have a one-on-one discussion with your doctor. Make them find out when it starts, what they go on with your life generally to know how to help you. Dr. AJ, you want to add anything?
No, I don't want anything.
Okay. It says, I have not seen my ovulation since I came off hormonal implants. Dr. AJ, you want to respond? So before he responds, no vex, I beg. Get one video where one of our ogas, our teacher, make with me. He did this page. That's why they beg people, make una try, they go through our videos when you did less busy. That video about 15 minutes to 30 minutes, he talk about contraceptives, talk about hormonal issue. And one reason we feel affect women, no, I just add that one for you so that if you go watch them, get more insights. So Israel, over to you, sir.
Okay, yeah. Most people, after they don't come out from hormonal family planning, let's just say family planning in general, it takes them some time for them to gain back their normal body hormonal function. It takes them some time. Some people, if it take them 2 months, 3 months, some fit take them up to 6 months for them to gain back their normal, how their body first day they work. So when you say ovulation, except you know your ovulation, at least you're supposed to talk your period first.
Yeah,
supposed to talk your period first. Okay, so if you say ovulation, it means that you know your ovulation. And most of the time, it is very rare. Say you see period, and you not see ovulation. Except there are other problem. About except there's another problem. So if you notice say it don't dey too long, like 1 year, you don't dey too long, you feel go visit gynecologist, so that may they try to track your ovaries to see how they produce, so that we will really know if you dey even ovulate or not. Yeah. So yes, some hormonal implants, some contraceptive can actually delay your menses, even delay your body to start to the function as in take the function before.
Okay. My sperm is watery. Can I get woman pregnant?
I don't know when you who tell you say your sperm dey watery. I think you should first of all be sure whether your sperm really dey watery, because I don't know who told you that your sperm is watery. I don't know who tell you say your sperm dey watery. So we know they use whether sperm dey watery or over thick till they know whether you go impregnate woman. But e not good make too dey over thick sha. We know they use that one till know. Wetin we tell they know na if the cells when go fit when we dey call spermatozoa, if e dey inside, if e dey viable enough to impregnate woman. That's the most important thing, not be wetin you see. Also, sometimes when you see say your sperm dey very light, I will call it light, it means say you are regular with sex, like you dey knack almost every time. So when you dey knack almost every time, it dey make sperm dey very light. Go make your sperm dey very light. And sometimes if your sperm dey very light, because you dey knack always, the cells when dey inside fit dey reduce, fit dey small. Not be say e finish, e fit dey small. However, for you to be sure, you need to see doctors, so that they will do some tests for you and even tell you whether your sperm really dey watery or not, so that you will not go use your mouth, use your body till they give yourself wetin you not get. Except this is not your real question, except there's something inside this question where you never tell us.
Good evening, doc. My period is heavier with clots. Since I came off arm implant, the clot is only for a day. I don't experience menstrual pain at all. I have been to a hospital. Doctor didn't see anything. He said it will go over time. It's a year and 6 months now. Okay.
Okay.
Then we want to respond. Yeah.
You know, most of the time, anything concerning contraceptive, there are so many things that the body try to make sure it goes back to normal. And yes, if your mess is not very heavy before, after your contraceptive, anything can happen. It can change. It can make your messes become a bit heavy. Now, because your mess is heavy, now make you they see those clots. Yes, as your doctor say, over time it will go. However, if you can say they be to the eye stand, maybe say as you they see your messes, your eye they turn you, or you they get other problem, I beg, see a gynecologist. I may not want to say I not really know the doctor when you see, but see a gynecologist. They may want to do a scan for you. They may just be something that is making the messes more than before. Even though we get the belief say yes, because you just come out from contraceptive, something like this will happen.
Okay. Is it normal for a child of 5 years to defecate after lunch almost every time? But she's healthy and not losing weight. When I say after lunch, I mean immediately she's done eating during lunch. Never heard this one before, Dr. Israel. You don't see this
Dr.
one
Brian,
before.
answer that.
Me never see them before, you know.
Okay, and
yeah,
you know, for some children, some things become habits. Some things become habits, and I want you to at least try deworm your child. Try deworm the pikin. Apart from that, as far you know, say you know they lose weight, you know they sick, nothing they do am, not worry yourself. But as I said, just deworm the child. Also, it can just be an habit, because some pikin they try the funny things. Feel be saying at that time, you just send in mind, and when it becomes an habit, it just maybe they do one before, and you look at nothing, so they must go toilet, whether you like it or not. And so it just be.
Okay. Next one, we are almost out of time. Ever since I found out that I had ulcer, my menstrual cycle has become irregular. Sometimes it lasts for 4 days, 5 days, and sometimes for 6 days. Please, is it normal?
It's normal. You are still within the normal range of menses. It's normal. So no fear. Don't worry yourself. It's normal. So it can just be
No
depend
worry
on the
yourself.
activities you do within the period. Now I go lead to those ones. So don't worry yourself.
Please share the live session. Please share the live session. Good evening. Please, what causes pains on the legs? Okay.
Dr. Fred, answer that one.
Pains on the leg can be caused by many things. Many things. Okay. Stress alone, standing for too long can give you pain. Your age, the age of the patient can even point to the direction of the pain. The location of the pain, whether na one leg or both legs, because if you tell us person they cause the pain. Person will get problem with the vein, DVT, deep vein thrombosis, we get problem for the legs. You understand? And issues with gout, if you get problem with their joint with gout. So there are a lot of factors that can cause you pains in your leg. Which they cause your own, like I go tell you, we don't know which kind of job you they do. Have you been involved in any form of accident before? Your age, even your body weight, all these things will point to the cause of your pain for the legs. Now, if this pain don't they do you for a very long time, maybe chronic pain, most times they will tell you, say, try to manage them, stop this, stop that. But if now pain we just start few days ago, maybe 1, 2, 3 days, try rest, try use analgesics, maybe now from the job where they do and rest your leg go. But if now long pain, we don't deal with you. The best thing to do now, make you see your doctor, then find out what's in the cause the pains, your own pain for your leg. We have a question here. Please, what is the cause of heavy headache on the forehead and on the center of the head? Wow. Dr. Israel, want to respond to this?
Doctor, please, what is the cause of heavy headache on the forehead and on the center of the head? Okay, severe headache, I guess, and that you're heavy. Severe headache. What's the cause? So, the forehead, the center of your head. First thing, most of the time, if person they get headache for the forehead, that's the front place. And one thing they try to find out if the person they use glasses before. If they use glasses before, I never check a glass for a long time, it can actually give you headache, severe headache. Also, another thing I be say, as far as don't they lead to the center, like they move to the center, we want to find out whether your activities, how stressful they are. How stressful they are. So all those things can also, that one physically cause you headache. So another thing when you physically cause you headache, because there are different type of headache. So I will just try to give you some things that will cause headache. So if there are anything inside the head, as we go always say, space occupying lesion, like things when go they follow the brain, they drag space for head. If it actually cause headache. Also, if you get some infections, and some diseases, some chronic diseases like hypertension and all that, it can actually still cause headache for you. It can actually still cause headache, but you know missing how headache they call the hypertension. Even malaria, you fit get headache because of that. Now, if you know they sleep on time, you know they sleep on time, you they always use your night, like say you they always use the night to do other things. If it still cause you headache, you they look screen for a very long time, it can actually cause you headache. So these are some things I just try to talk some things when they quickly they do when go fit cause headache. So what they cause your own, as Dr. Fred always say, we will not tell you, but the best thing is to see a doctor and explain better to the doctor, then he'll be able to tell you what and what to do. Dr. Fred.
Yes, we have a question here. We are almost out of time. Please keep sharing the live. Keep sharing. Is hepatitis B really curable? Are you asking, or you are telling, okay, is it curable? The word is hepatitis B can be managed. We're talking to you from the medical
They are.
perspective. They ask, from the medical perspective, hepatitis B for now, no get cure. I want to come again, and I think I know why they asked this question, because if like say you asked us about the drug before, and we skipped your question. Hepatitis B no get cure for now. Now I know some pages where I don't see online. We go promise you say hepatitis B get cure. No vex, so we don't know about those guys. But what we go tell you be say it can be managed. They will help you check your viral load, check your liver enzymes, liver function test, and see if everything dey okay. If everything dey okay, they will tell you may you go ahead. If there's any problem where it cause, they will tell you and they will help you manage them. The doctor to see now gastroenterologist. You understand? But for now, hepatitis B no get permanent cure. Dr. AJ, you want to talk anything to add?
For anybody when they fear, the good thing about hepatitis B is that it get vaccine. So for those who never get hepatitis B, or you never know,
Yeah.
go and test yourself. You test yourself
Yes.
and you see saying a negative, go take the vaccine so that you know go come ask again. If you know go come go they look for cure. We get vaccine, so the vaccine will protect you. But cure, for now, no. With a manager, yes, it can be really managed very well. That somebody feel live life till God call am without stress, but it fit just dey there for life.
Okay, we have a
Dr. Red,
question here. Yes, we have a question here. We are almost out of time. Is it true that people with cryptic pregnancy can menstruate or sports, not feel any form of pregnancy? Even them themselves wouldn't know they are pregnant till labor begins. Mary Queen, I've seen a lot of your questions. There's a video about cryptic pregnancy on my page. I shared a story of a young girl in that video, true life story, reported in a journal of a young lady who was pregnant and didn't know that she was pregnant. I talked that one. But there's a scam of cryptic pregnancy in Africa. Let me use the word Africa, and in Nigeria. There's a scam. This scam is carried out by people wey go lie, tell you say na cryptic pregnancy you get. Say doctor no go see the belle, hospital no go see the belle, scan no go see the belle because na cryptic pregnancy you get. Those people, they be thieves. The real definition of cryptic pregnancy, like you talk and be say, this woman will get belle, she no go know. Yes, earlier when I just finished school like that, I know they believe these kind of things. But after more research, more stories, it dey happen, but very, very rare. So no be say a girl go get belle, people just say, no, not like it dey very rare, but it dey happen. But the one way that they do for Nigeria, some very wicked people, where government supposed to arrest all of them, they will tell you say na cryptic pregnancy you get, whereas belle no dey, nothing dey inside there. They go tell the woman make you no go hospital, make she no go any doctor. Now only them 950 the pikin, say the pikin hide for back, abi hide for leg or hide for head. That one is not cryptic pregnancy. That one now criminality. So try go to my page and watch the video. May you see the story of the young girl. Dr. Israel, you want to add anything to that?
No, I think you said it.
Okay. We have a question here. Our time is almost up tonight on this live session. Please, doctor, since 3 days, I've been feeling pain in my my two nipples. You want to say something on this?
Okay, if you are feeling pain in your nipples, if you don't see your menses already, just try and find out when last you see your menses. Maybe now your ovulation period you dey. If you don't miss your period, maybe you don't get belle. So those are two things that may actually cause natural thing that can actually cause pain in the nipple. Another thing is if maybe you want to see your menses, some people see they get pain for their nipples like that. Also, see try and know the size of your breast, whether it don't enlarge past before. But if you get pikin, try check, and the pikin dey suck your nipple, try check whether you don get, whether not be crack nipple you don get, like whether na crack nipple you get, because all those ones fit cause pain for the nipple. So if all those ones are sorted out, Dr. Fred.
Yes, I did hear you.
Dr. Fredo, if all those ones are sorted out, then you feel not get anything to fear about, to be afraid of. No need to fear anything. But if not, just try touch the breast round, whether you go see anything like seed or swelling for inside. So when you don't see all those kind of one, when it's different from wetin you know say na normal, if you dey do breast examination before, you go fit differentiate your normal from your abnormal. So if you don't see something like that, then you can now go and see your doctor, and a gynecologist and general surgeon you need to see to be able to tell you what and what to do.
Okay, let's take the final question tonight. Let's take the final one. Doc, please, sometimes my husband's urine is foamy, and sometimes and smells, though not much. Hope we are safe. Dr. Israel, you want to respond?
I will want you guys to go to the hospital and do a test on that urine. Apart from the urine, you need to do a kidney test as well, because you never can tell, anything can happen. May not come like say they scare you. One is, it may be that your husband maybe he drink too much that period, wahala don dey enter the kidney small. So for you to quickly detect am, na the best way to solve the wahala. So because of that wahala part, now make I say make you quickly go hospital so that they can run some tests for you concerning the one for the urine, wetin go dey make am dey smell, why dey fall, whether there's protein in the urine and all that. Two, they fit do some blood tests to check for the kidney itself, whether the kidney is functioning well, or not. So those are the things you need to do so that you go fit, so that your husband fit continue performing well for you.
Dr. Israel, let's respond to this in like 30 seconds. Doctor, a friend of mine told me that she doesn't see blood when menstruating, that her palms do turn red. She said that is how she menstruates. How true is this? Come on, no now. No. There's something fishy somewhere. Menstruation, the process of menstruation, they say after a while, blood from the uterus, the wall of the uterus, endometrium like that, go shed, go come out. So any other thing which person talk, that is not the definition of menstruation. And your friend know what they talk. We no one come here create problem. Say yeah, but I just gave you the definition of menstruation. Menstruation be say every month or in a cycle, a time will come where the uterus and everything the inside will come out and blood will come out. Now that one be medical definition of menstruation. Dr. Israel, any other thing we want to talk?
Well, I don't hear something like this before. Someone actually told me that whether he auntie or so, not the same menses, say, but a big toe, now the red, and sometimes when I see the pain now, I don't hear something like that.
Okay, what we go do? We go have a discussion on this to know more.
For this life, one thing I've noticed is that you never can say
never. Okay, let's keep our mind open. We'll visit it. Okay, yes. Okay, so let me say this again quickly. Dr. Israel, your network, what's in the happen? I remember I said something before that I had a patient who never saw her period one day and she don't born. Yeah. Okay. So let's go back. So your friend feel no see period, but that her red sign, maybe now her body they change, but that is not menstruation. Do you understand? That one no be menstruation. Say the hand red. The definition of menstruation be say blood go come out. But yes, I don't see one patient, one woman, though she's late, she no see period. She gave birth to 9. She was a grandmother then. I couldn't ask her, Mama, you lie to me. She said, No, he tell me the truth. So, yeah, it can happen, but say her hand they red, that is not the definition of menstruation. However, we will do more digging again and come back later and to give you more information. If indeed, though, that one on menstruation, we will let you know. Dr. Israel, any final words as we round up? Final words. Our time is up on the live session. Hey, my God, your network don't seize again, Osalubua. Okay, ladies and gentlemen, thank you very much for the time. We are done for tonight, and with the shutdown. We dey start every Sunday, 8 p.m., 9 p.m. We don't finish. But I want to talk something. I beg, please. I be make one post about a fake page. The page get about 43 followers. That page we post my videos, na scam page. I now have 4 Facebook pages. One is in French. That one day for French. Though I never post any video there. Then I get 3 other pages: 70,000, 79,000, 42,000. That one on my pages. The 4 of them plus the French page. But that other page will be 43 followers. We post of my videos. I beg, not be me. And I dey fear the social media. Make nobody come chop people money. They'll come they drag me. You know, say me. Nothing they my nyash. So me no vex. Thank you all for joining us today. No vex if you know to take your questions. We dey try to keep to time. We no one come here, come they talk as you say we know get guidance with time. During the week, I will come online and I will try again to answer your questions. Furthermore, I know they do private chat on social media. We know they do private chat. We know they give our number online. But what we they do online consultations, in case, that one, in case, for those who really say I won't follow you talk, we they do online consultations. But say we they do private chats, I won't call you, doctor, make I ask a question. No vex. We know they do that one. We don't get time for that. Thank you once again. We don't take your presence here for granted at all. We appreciate every one of you for spending your data on the page. God bless you, and I wish you all the best. Remember, good life now waiting. Good life now waiting. Tell me, good life now waiting. Mr. Alex, I see you. Good life. Oh yeah, now talk to me as we shut down. Let's go, Mr. Alex Ogua. Yeah, I see you. How you doing, Baba? Nobody want to respond again. Nobody's responding. Okay. I want one person to respond. Let me know. Good life now waiting. Yes. Thank you, confidence. Good life. Yes. Tall guy, good life now sense. Yes, good life now sense. God bless you all. Take care of yourself and have a wonderful night. Bye-bye.